Hello, today we'll be demonstrating how to infuse your medication using an Elastomeric device. My name is Connor and I'm with Physician's Choice Infusion Pharmacy, and let's get right into it.
Alright, now let's talk about some of the supplies we're going to be using today. So first I'm going to grab our saline, and our saline is going to be in a syringe. It's going to have, we know it's going to be saline because it's going to have a white or clear top. It's also going to say sodium chloride down on the side. Now we're going to be using 2 of these per infusion. So now that we know what these are, we can go ahead and set them to the side. Next we're going to have our heparin. We know it's going to be heparin because it's going to have a yellow or blue top. It's also going to say heparin down on the side. Now the heparin is going to be just a little bit smaller syringe size than the saline. We're going to set that one aside. Next we have our alcohol wipes. Now we're going to be using alcohol wipes on our lumens just to make sure we kill any bacteria before we do any infusions. We can set that right here. Next we have our green caps. Our green caps are disinfectant caps. And on these caps, they have a peelable sticker on there, and we're not going to peel that sticker until we're ready to put it on at the very end because it is going to have alcohol and medicine in there, just the same as the alcohol wipes. Now we have our Elastomeric device. So this is going to be what holds our medication, and it's very important to take a look. You're going to have, similar to a regular prescription, you're going to have your name and the name of the medication and the dosage information on the tag. This one's a little bit smaller because this doesn't have any medications in it, but yours will. It will have your name, it will have the dosage, and it will have all the information on there. Next, this Elastomeric device, this is going to be a pressurized ball. So once you go ahead and start the infusion, you don't have to keep it above your head. You can just let it do its own thing. So whenever you do receive your package, you're going to have a big bag that has all the Elastomeric devices in there. You're going to take that out and put it in your refrigerator. And you're going to take out the device typically about an hour to an hour and a half before the infusion time, just to make sure it gets to room temperature for comfortability reasons and to make sure it flows at the correct rate. Right now we say the ball looks 9 months pregnant. And towards the end of the infusion, it's going to look like an apple core. Typically, that can take anywhere between 30 minutes to 2 hours, maybe even an hour and a half. And if you have any questions, feel free to reach out to your pharmacist for answers. Alright, so our first step is going to be find a nice, hard, clean work surface. And then we're going to go ahead and make sure we clean and sanitize our hands, making sure we clean on the insides of our fingers, on the back hands, and just making sure we get our hands completely sanitized before we start the infusion. Alright, so our next step is going to be to grab our Elastomeric device, and these are already going to become primed, so we can go ahead and make sure we set it in this administer spot. Before we actually start the administration, we're going to make sure we prime each one of our syringes. So we're going to do that by grabbing the syringe, twisting off the top just a little bit, not taking it all the way off, just to let a little bit of the air out. And so what we're going to do is we're going to pull back just a little bit to be breaking that seal right here. The reason why I want to pull back and break that seal instead of pushing up is very easy to push up too hard and just shoot up everything. So to try to minimize some of the mess, we pull back and then we're going to push up, letting up maybe a drop out just to make sure no air is left in the syringe, and we're going to close it back up. And we're going to set it down back in our saline spot. We're going to do the same thing with this other saline, twisting the top just a little bit, not taking it all the way off, pulling back, breaking that seal and pushing up to make sure we get all of that air out of there. And we're going to do the same thing with this last heparin, last syringe we have for this infusion. So we're going to pull back, break that seal, push up just a little bit, get all the air out of there, and then we can set it in our heparin spot. Now we have everything primed and we're ready to start the infusion. Okay, now that we have everything set out, we're ready to go ahead and do our first infusion. So what we're going to do is we're going to take our disinfectant cap that was on there from the previous infusion. We're going to be able to go ahead and take that off, set that to the side. Everything's going to be thrown away after we open and use it. We're going to grab our first alcohol wipe here. We're going to be cleaning the outside of this lumen for about 10 to 15 seconds, just scrubbing it as best as we can. And then we're going to sit here and let it hold for another 10 to 15 seconds, not to swing it around because that actually tends to get more bacteria on the end of here. So since this is already primed, what we're going to do is we're going to grab our saline syringe, we're going to open it up, we're going to connect it to our lumen, and this is going to be a nice gentle push in and twist. And everything we use here is going to be the same way. It's a nice gentle push in and twist. And what we're going to do next is there's going to be a clamp right here on your line. And so this clamp is going to ensure that stuff only flows into the line whenever we want it to, and stuff flows out of the line when we want it to. So right now it's set to close, so we're going to set it to open, and then we're going to flush our line. And we're going to do that as in a pulsing motion, and that's going to look like 1 Mississippi, pause, 1 Mississippi, pause. Continuing doing that until the full syringe is done. We're just trying to stick away from doing it all at once. And so now that this syringe is complete and we've flushed it, we're going to reclamp our line just to make sure that nothing comes out or nothing comes in as we disconnect. So I'm going to disconnect. I'm going to grab my next alcohol wipe here. I'm going to open it up, set it to the side, get a nice clean, 10 to 15 seconds, making sure we kill any bacteria that might be there. And then we are going to throw that away, letting this dry for another 10 to 15 seconds, not to swing it around, just to make sure no more bacteria gets on there. So now we're ready for our elastomeric device. And so what we have to do is we will just twist and connect it similar to the syringes. It's a nice gentle push in and twist. And then now that we have it connected here, there's going to be a clamp that's going to be on our line, and then also a clamp that's going to be on the device. So what we're going to do is we're going to open the clamp that's on the device, and then open the clamp that's on our line, and that's going to go ahead and start the infusion. And like before, these balls are going to be set to a certain particular time, dependent on the size, from anywhere between 30 minutes to 2 hours. And if you have any questions on what your ball is set to, go ahead and ask your pharmacist and they'll be happy to answer that. So let's just say an hour has passed and it is turned from the 9 months pregnant into the apple core. And so what we're going to do is we're going to need to clamp our PICC line, just again to make sure nothing comes out, nothing goes in, and we can go ahead and disconnect the elastomeric device. And like I said, everything's a one-time use, so this could just be thrown away in the trash. I'm going to grab my alcohol wipe once more, open it up, cleaning the end of this lumen here, 10 to 15 seconds, and then sitting here letting it dry, grabbing the syringe of saline. That's the next step in this process. Do another nice gentle push in and twist, connecting the syringe to the line, setting the line to open, allowing the flush to flow in, and then we're going to do another pulsing motion that's going to look like 1 Mississippi, pause, 1 Mississippi, pause. Again, just trying to stick away from doing it all at once. Now that we have completed this syringe, what we're going to do is we're going to reclamp our line, and then we are ready to disconnect the syringe. We have our last alcohol wipe here. We are going to open that one up. Same thing as before. We're going to be cleaning the end of this lumen, give it a nice rub down, letting it dry for another 10 to 15 seconds, not moving it around. And then we're going to grab our last syringe here, the syringe of heparin. And so we are going to open it up, push it in, and give it a nice light twist, just as similar to all the other ones. Twist it in there, and then unclamp your line. So it's going to allow the heparin to flow through into your line. So I'm going to unclamp, and then again doing a pulsing motion, just the same as similar to the other syringes. Again, we're just trying to make sure we don't do it all at once. And so we've completed this syringe. So what we're going to do is we're going to clamp up our line, and this is going to be the last time we clamp up our line, and we're going to disconnect it. And then the last step here, we're going to grab our green disinfectant cap. And what we're going to do is we're going to peel this top off, and we're going to connect it to the end of our lumen. And the reason why we don't have to put an alcohol wipe before we put the disinfectant cap on is because it has all the medicine and everything in there to kill any bacteria that might be there when we attach it. So that's going to conclude the end of our infusion. If you have any more questions on the benefits of home infusion or to see if you qualify, please feel free to visit us at our website, www.pcipharmacy.com.